Good day, I'm Dr. Ntokozo Ngcobo. I'm a specialist psychiatrist and honorary lecturer from South Africa. And today we'll be discussing dementia standard of care. What does it mean in South Africa? But we'll also be looking at other factors that are similar in many LMICs. So just a bit of context. So South Africa is the southernmost country in Africa. And it's a multi-ethnic society with over 60 million people, encompassing a wide variety of cultures, religions, and languages. So it's estimated that there are about 2.13 million people were living with dementia in sub-Saharan Africa in 2015. And this number is estimated to increase to reach 3.48 million in 2030 and 7.62 million in 2050. Which is very alarming. Looking at South Africa, and then certain research studies show a prevalence of 6 to 12%. However, these figures are probably an underestimation of the real burden of disease because prevalence data and prevalence studies are lacking, but also the awareness of dementia in society is lacking. So when we look at South Africa, it has the highest proportion of elderly people in its region of 8.7%. And the number of elderly people is estimated to increase to 14.2% by 2050. So it's clear that there's a considerable number of people living with dementia in our country. So when looking at South Africa's healthcare system, South Africa has a private and public healthcare system that run in parallel. And when looking at the public healthcare system, which the majority of the population use, the entry would be via primary healthcare or community healthcare, and then a referral to district healthcare, and then a referral to regional services and tertiary services if needed. So if someone presents with symptoms suggestive of dementia, they would ideally start at a primary healthcare where they would get an initial assessment by a non-specialist. And this assessment would entail a history taking and physical examination, and then appropriate blood tests and urine tests to exclude reversible causes of cognitive decline. However, in many, in the primary healthcare and community healthcare system, there's certain blood tests that cannot be done. So that would mean that thus the patient would need to be referred further on. And there could be cognitive screening done there and psychological services also. And then referral to a regional level care would be where then the patient would be seen by a specialist. And here there would be history taking, physical examination, and then exclusion, so investigations to exclude reversible causes of cognitive decline. And at this level, the patient could then get neuroimaging in the form of a CT brain, and then cognitive screening done at this place as well. And then the patient would be managed by a multidisciplinary team, which would include psychological services, OT, social workers, etc. But sometimes in certain settings, the full MDT is not available, and the referral centers or the regional level of care are outside of the rural areas, so they are more in the urban areas. And then, if need be, the patient could be referred to a tertiary or subspecialist units, and these units would be the units that have memory clinics. And at these levels, the patient would then have access to further imaging or more neuroimaging in the form of an MRI SPECT. And at this level, there is also a multidisciplinary team.